So I'm going to welcome everybody that's joined us now because you're all on time. It's 1 o'clock. I'm Rabbi Dan Moskovitz. We're going to give it just another couple of minutes as I see the numbers ticking through before we start in earnest. But please, a note that you can put questions through, I believe, through the question and chat dialogue. And it's open for questions, I believe, at this point. So there's a Q&A button down. For those that have joined us via Zoom, there's a Q&A button down at the bottom of your screen. And I think that you can submit a question there. And then as you see questions that others have asked, I think you can click on an upvote button so that if that's a question you would have asked, we'll get a sense of how many people wanted to ask that question. We'll give it just another minute or two. There's about 100 people who have joined us and another 120 or so that are still coming according to our reservations. So it's nice to see everybody joining us online. I want to thank the Jewish Federation of Greater Vancouver for co-sponsoring today with us. It's wonderful to partner with all of our Jewish organizations. Though Temple Sholom is hosting this, it's open to the entire Jewish community and really to the broader Vancouver community. And I know we had some media interest as well because Patty and Eric are really, you are the place to go for the questions and the answers. So we're really fortunate to have this opportunity. So as those are joining us, let me just give a little bit of background. This is part of a 4, maybe 5-part series that Temple Sholom is hosting called Let's Talk About It. We begin today with Doctors Patty Daly and Eric Grafstein, who I'll introduce in a moment, and that's followed by on Wednesday with a forum from ZLC and Gary Zlotnick and his partners on financial management and planning in a pandemic. That'll be followed by a forum on parenting in a pandemic with Gail Cribble-Zacks, and then a forum soon to follow after that on mental health in the midst of a pandemic. And we're also trying to arrange a public forum with our Member of Parliament to talk about the government response as well. And that should all happen in the next 2 weeks or so. To find out more information about that, you can visit us online at templeshalom.ca. So Doctors Grafstein and Daly, welcome. Really, it's great to see you in person. I know I've been bombarding you with emails throughout this pandemic. I bet you're hoping that now that I finally get you online, we can stop with the emails from the rabbi. So I first wanted to start by introducing both of you. Dr. Eric Grafstein is the Regional Head of Emergency Medical Medicine and Chief Medical Information Officer for Vancouver Coastal Health. And he's been practicing emergency physician for 34 years. He's also a Torah reader at our synagogue, and we appreciate that, Eric, every time that you get an opportunity, and we have an opportunity to have you do that. Dr. Patty Daly is the Vice President of Public Health and Chief Medical Officer for Vancouver Coastal Health. She's also a clinical professor in the School of Population and Public Health in the Faculty of Medicine at the University of British Columbia. And Dr. Daly has been an incredible resource for everyone in the community, and particularly in the Jewish community. Both are members of Temple Sholom, and we've been reaching out since the beginning of this to ask some questions and get some very specific answers as they regard to the Jewish community and our synagogues and institutions. So thank you both so much for being with us today. So I am going to really start with sort of a pretty open question for both of you. And I guess Eric, I'll start with you. So can you give us an update in your role, in the emergency rooms on the state of emergency medical services and our capacity to handle this pandemic now and in the months ahead here in Vancouver?
Thanks very much, Dan, for the question, and thanks for the opportunity to chat with all of you. I'm going to give a very short answer and then expand on a little bit. The emergency departments have capacity now. The emergency departments are a safe place to go during the pandemic, and that even though there's a pandemic, emergencies are still emergencies. And if you have things like chest pain or shortness of breath, or if you have symptoms that you think might be a stroke, you should be coming to the emergency department. And if it's okay with you, I'm just going to share a screen to show a slide. This represents a graph of emergency visits in Vancouver. There's 2 lines, a squiggly red line that represents last year, 2018 and 19, and a blue line that represents this past year, the last few months. And what you can see is that there was when the blue arrow or the purple arrow happened, that's when the public health emergency was declared in British Columbia. That's around the time that we saw a huge decrease in ED visits to about 50% of normal. And, you know, that was alarming for us because the number of sick people also kind of fell, the number of people we admitted. And really that seemed to signal that maybe people who might have been sick were holding off because they were worried or they were afraid or whatever, or maybe they just weren't getting into car accidents or injuring themselves because they weren't as active. And the green arrow shows the time when we kind of recognize and reach out to the public to say, no, the emergency department is a safe place to go. And since that time, we started to see a slow trend upwards, and we're about 70% of normal. So lots of capacity, and the EDs are safe. And I'm gonna stop sharing.
Thank you, Eric. Thanks a lot. Patty, I guess the same question to you. What's the state of our city right now? You know, where are we at, and what's coming to the best extent that you can tell us in the next weeks and months as we deal with this crisis and this virus?
Well, I'll give you some numbers, and I didn't bring a nice graph as Eric had done. He scooped me on that, but I will tell you that in Vancouver Coastal Health, and our region has about 1.25 million people. It's not just the city of Vancouver. It goes from Richmond to Vancouver, North Shore, Sea to Sky, Sunshine Coast, and some rural communities like Powell River and the Central Coast. Within our region, we've had just over 800 cases of COVID-19, 823 as of yesterday. The first case was identified on January 15th. That was a traveler returning from Wuhan, China, which was the epicenter of the outbreak at that time. For the first 6 weeks after that, we saw only very small numbers of cases in returning travelers and a few of their household contacts. And then in early March, we did start to see spread of COVID-19 within our region. And actually, most of that spread is likely from people who had crossed the border from Washington State. So while we were screening and isolating returning travelers from places like Wuhan, China, and Italy, there's lots of traffic normally, as you know, across the Canadian-US border. And Washington State was the first place in the United States to have an outbreak of COVID-19 that went unrecognized for a number of weeks. And we believe actually a lot of our community spread came from Washington State as well. In early March, we did start to see cases among people who had not traveled, who had no known contact with another case. That's an indication of community transmission. And actually the very first case of community transmission in BC is somebody who was also a staff member at the very first long-term care facility in Canada to have a COVID-19 outbreak. And that facility was in our region. It was the Lynn Valley Care Center on the North Shore. Since that time, we saw an increase in cases, but that peaked in mid-March. So since mid-March, we've seen a decline in reported cases. And in fact, we've done a very good job of flattening the curve here, not only in our region, but across BC. Just to make a comparison, we have over 800 cases in Vancouver Coastal. The city of Montreal, which has about 2 million people, so it's a little bit bigger than us, they have had 13,000 cases of COVID-19. And while we have had outbreaks, we have outbreaks now in 7 of our long-term care facilities. We had 6 others that are resolved. They've had well over 100 outbreaks in long-term care. And while we have had deaths, unfortunately, here, most of them in long-term care, not as many nearly as in places like Montreal and Toronto. So just to give you some more of the numbers, as I mentioned, over 800 cases. The vast majority have been mild. So over 80% of people have recovered at home, have not required hospitalization. In fact, most of those cases have now recovered. 18% of our cases, or about 150 people, have ended up in hospital, and 7% in the intensive care unit. And we have had 72 deaths. Now, I think what's important to note is the most important risk factor for severe disease has been age. So the median age of death in our region has been 87 years of age. And in fact, 3/4 of all our deaths have been in people 80 years of age and older. So that we know is the population at greatest risk, and particularly residents of long-term care. So over 50 of our deaths, of our 72 deaths, have been in 6 long-term care facilities where we've seen deaths, and we've taken a number of steps, beginning here, but now we've been a model, I think, for what's been done in other parts of Canada to try and protect those very frail residents of long-term care. We're now at a point where we have significantly bent the curve. And this is probably the lowest we're going to see for the foreseeable future. Our modeling now indicates we can begin to start lifting some of the public health measures that have been in place. And many other provinces have actually come out with their guidelines for how they're going to lift public health measures, even provinces that are experiencing more COVID-19 activity than we are in BC. Our plan will be released next week. But just to let you know, some of the areas where public health officials feel we can start to open things up again. First of all, we want to resume healthcare services that have been canceled or put on hold. As Eric talked about, we have continued with emergency services and urgent services, but lots of things have been canceled. Elective surgeries, many of our outpatient clinics have been canceled, and we're starting to see some of the harms associated with that. People with other quite severe chronic disease who haven't necessarily got the care that they need. So we are actively planning to resume a number of healthcare services. We also want to resume outdoor activities and recreational activities. We've tried as hard as we can to keep parks and outdoor spaces open in Vancouver and encourage people to be outdoors. We've done a better job of that in BC than elsewhere. And actually that may be one of the reasons why we've bent the curve, because we now know that COVID-19 is only very rarely transmitted in outdoor settings. The virus doesn't survive well outdoors. So it's actually quite safe to be outdoors in parks, walking, exercising, and enjoying the outdoors. The second thing we do feel that we should be resuming is opening up daycares and schools. And that's because as the pandemic has progressed, we've identified that children seem to be at much lower risk of infection with COVID-19 and also much less likely to transmit the virus to others. And that's different than other respiratory viruses like the flu, which often do circulate among young kids and in schools. So daycares, which have never actually been closed in BC, but a number have closed on their own, we will try to get them up and going again. The province may not make a decision to fully reopen schools this calendar school year. A number of schools are already open and providing teaching and some care to a small number of students. We do think we need to have a plan going forward to reopen the schools. And my preference would be we try and do that before the end of the school year. We also know that that in addition to healthcare services, daycares, and schools, that many businesses closed voluntarily. They were not ordered to be closed. In fact, the only businesses ordered closed in BC were bars, restaurants that have in-restaurant dining. They can only stay open for takeout or delivery, and personal service establishments like hairdressers and spas and others. Most other businesses closed voluntarily. They can now reopen, and we'll provide them with guidance about how they can reopen in a safe manner, because we do know that even as we start to reopen, the virus is still here. It's not going to go away, and we have to monitor closely to make sure we don't see big increases in cases. And so there will be measures put in place similar to those measures that, for example, the grocery stores have in place to make sure we don't have too many crowded people in some of these businesses, that we do maintain some social distancing. We will emphasize the importance of staying home if you're sick. And we have recently opened up testing. So it's available for anyone who has even mild symptoms of COVID-19. And the reason we did that is because as we lift those public health restrictions, we want to be sure that we quickly identify any increase in cases and isolate those cases and follow up on their contacts. So you will start to see things open over the coming weeks. It will happen slowly, and we'll make sure that we do it in a way that doesn't lead to a dramatic increase in cases.
Wow, that's wonderful news. That is, I think there are everybody on this call, and maybe every parent who's been doing homeschool is very encouraged by that, and it's really that's terrific. Kol hakavod to us, I guess. I want to follow up just a little bit. So this virus is it's different than SARS, right? I mean, SARS went away. Why won't COVID-19 go away? You say the virus is going to be with us, and we hear it's going to be with us for a year or two. Why won't this go away?
Well, they're two different viruses. They're in the same family, but they're actually quite different viruses. SARS was much less easily transmitted from person to person. And I was here in Vancouver with the importation of the 4 SARS cases that we had. We only had a single transmission. Only one person in BC got SARS from one of those imported cases. I know there were outbreaks in other communities, but it became quite clear with SARS that most people who had SARS did not transmit it to any of their close contacts. And one thing we often look at with infections, is the number of people that a case is likely to transmit it to. You may see this if you Google SARS and COVID-19, it's called the R naught. And if on average, someone with the virus transmitted to less than one person, then the virus will die out. And that was the case with SARS. Very few contacts were infected. COVID-19 is different. The average number of people that a case will infect is 2 or 2.5. Doesn't sound like a lot, but that's enough to propagate an outbreak. Now we can, and ironically, viruses that cause milder disease are often more likely to be transmitted. So SARS caused a more severe disease in the lungs. Most COVID-19 cases are milder, the disease in their upper respiratory tract, and that's why the virus is more easily transmitted when people cough or produce those small droplets. It doesn't mean we can't stop the spread through things like staying home if you're sick, social distancing, isolating contacts of cases, but we don't yet, without a vaccine, we're going to have some of those measures in place. We're not going to see the virus disappear.
Thank you. And somebody texted me to increase my mic volume, so I'm trying to do that as best I can. Eric, I want to come to you with a question, but I want to ask Patty, well, let me first say this. If you have questions for either Doctors Daly or Grafstein, you can add those into the Q&A at the bottom of the Zoom window there. A number of them are flying in, and I'm going to get to them in just a moment. Eric, let me ask you this question, then I'll come back to Dr. Daly, to Patty in a moment. Eric, in our home, 7 o'clock is it's a sacred time. It's kind of like Shabbos every day. When 7 o'clock comes, everything stops. We go out and bang pots and pans. We blow the shofar in our home as well. The outpouring for our healthcare workers and our frontline workers in this city, I know, has been tremendous. I guess that's maybe one of the positive results of this whole thing, has been a recognition of the important role that our healthcare workers played in public health. A couple of questions. One, have there been any incidents of transmission within our hospital system here in Vancouver to frontline medical workers? Have there been any shortages of personal protective gear or the necessary supplies that you've needed in order to fight this disease?
Thanks, Dan. I want to start off by just acknowledging that all the support from the community is just so appreciated. And I think it was quite shocking to my colleagues working at St. Paul's to come outside at 7 o'clock and see all the noise making and signs of appreciation. These are incredibly uncertain times, and that uncertainty creates actually some fear. And for healthcare workers, this whole COVID pandemic has been scary. And there are places like Lombardy, Italy. So that's a place that has roughly twice the population of British Columbia, and yet they have up to 700 or 800 deaths a day there. And the fear that might happen here was really, quite sobering and caused a lot of concern. And as I said, that the support from the public has really energized healthcare workers and allowed them to, do their job in a way that I see them demonstrate kindness and courage, and in a really stressful environment. And more than that, there's been outpouring from restaurants and businesses. I know Rabbi Bregman's family supplied meals to some of the emergency departments, which was just so touching and so helpful. I think that bears underscoring, and thanks and appreciation from myself and the other healthcare workers. As far as physicians or other staff who've gotten sick, Patty would have a better sense. She can comment on the long-term care facilities, but in the emergency department, I only know of one healthcare worker who became COVID positive, and this is a colleague of mine working at St. Paul's, and I'm almost positive that he did not get this in the hospital. And in fact, there's been very little transmission, I think, from, if it's a baseball game or a football game, it's like healthcare workers 0, patients a lot, because it tends to be healthcare workers who transmit to patients. Healthcare workers get this in the community. And just to underscore the point, I look weekly at the testing results. in the emergency department. So around Vancouver, we've done some 600 or 700 tests a week, and only about 2.5% of them, 2% of them are positive for COVID. And if you extrapolate that to the whole ED population, you only end up with about 2 in 1,000 people who come to an emergency department in Vancouver Coastal Health who are positive for COVID. So what that tells me is that it's actually not that unsafe an environment, both for healthcare workers and for the patients who come there. And just to underscore, we've set up emergency departments so that, you know, when patients have suspect cases, they're segregated. So people who don't have COVID, they're not put at risk. And, you know, I think we've done an excellent job of that. As far as the personal protective equipment, I have to give a hats off to the other leaders in Vancouver Coastal Health who are shepherding the logistics and the procurement of these personal protective equipment, these PPEs. I think at various times in the last 6 or 7 weeks, there's been some concern about whether or not we would run out. I think we've developed strategies to be economical and yet safe. So, for example, I wear a mask with a face shield. I put it on as soon as I come into the department, but I keep that mask on unless it gets soiled until the end of my shift. So I think now, because of donations and because of support from the community and just the ability now to buy more of these devices, this supply is relatively safe.
And if I could just comment on the healthcare workers, because my office does follow up every single COVID-19 positive case. I mentioned there's been 823 as of today within our health authority. And that includes any healthcare workers who are positive. And Eric is exactly right that this is different than SARS. This is primarily transmitted in the community. And almost every healthcare worker case that we've identified, and I don't think they're affected at higher rates than some other populations, we believe the transmission has occurred in the community. Now, the only cases we're reporting publicly are among long-term care facilities where we have outbreaks. And we do report the number of residents who are positive and the number of staff. And in several of those outbreaks, in fact, in almost all those outbreaks, the virus, we have evidence it was brought in by the staff who were exposed in the community. And they may have inadvertently exposed other staff members to the virus as well as residents. This is not a criticism of those staff. Many times their symptoms would have been very mild. They would not have even realized that they'd had COVID-19. And that's one of the reasons why we've now, the personal protective equipment that Eric has talked about, that's not just being used in our hospitals. Now all the staff who work in long-term care in our region and across BC are also now wearing masks and eye protection and gloves. And actually that's not just to protect themselves, that's primarily to protect the residents, to prevent them from exposing patients and residents to the virus. So healthcare workers, yes, there have been some cases, but we believe the personal protective equipment actually prevents you from being exposed in the workplace, and that if you are a healthcare worker, if you do get infected, it's probably more likely that you acquired it in the community.
Great, thank you both. We're getting dozens of questions coming in, so I'm going to try to run through all of them now, and I won't call it a lightning round, but we'll try to get to as many of them as we can. A number of questions have come in about vaccines. And we know yesterday in the States, Dr. Fauci announced that one of the 7 vaccines that they have from around the world was going to go into a phase 2 of human trials and to even perhaps a broader production so that it could be ready to be used. What are we doing about vaccines here in Canada? What would be the plan for a rollout of vaccines? Where are we at with vaccines? I have a couple of questions with all of this. Are we dependent upon the United States here? Are we, is there a sharing of the formulas for these vaccines and our own testing that's going on? Tell us about vaccines.
Sure, and I follow this avidly because, like you, as a public health person, I know that the ultimate solution to this, the pandemic, we don't want to wait for everybody to get infected. We'd like to get a vaccine, just as we did with the influenza pandemic. So I've been following the trials. There are a large number of vaccine trials underway. The one I think that most excites people, including me, is the Oxford vaccine, because that is the one that's going to phase 2 trials. So for those of you who don't know about vaccine trials, phase 1 is when a very small number of humans are given a vaccine to make sure that it's safe and that it can produce a response, it can produce antibodies to the organism in the vaccine. There are phase 1 trials underway, including one that's recruiting people in Washington State. Phase 2, after you demonstrate it's safe, you can go to a larger human trial, a phase 2 trial. Now, what's interesting about the Oxford vaccine is that the researchers in Oxford were already working on a coronavirus vaccine. There are other human coronaviruses that cause the common cold. They were working on a vaccine before the pandemic started. They had been through phase 1 trials already. So using the same technology, they can move first to a phase 2 trial, which means they're recruiting many thousands of people. The other thing that they've done, which I think is really important, is they've given the vaccine to a small number of primates, 6, so not a large number, but then they challenged those primates with the COVID-19 virus. You couldn't ethically do this with human beings, but they could do it with primates, and that for that small number of primates, it was 100% effective in preventing infection. So now they're going to the phase 2 trial, and actually you want to do that trial in a place where there's a lot of COVID-19 to see not only that it produces antibodies, but within a community where there's lots of transmission occurring, those people are protected. The UK actually is a place where they've had a lot of COVID-19. It's got one of the worst outbreaks in the world. So they want to get that, if they can get that phase 2 trial going quickly, it's not as if we're hopeful that they'll have a lot of COVID-19 in the UK, but it will help us demonstrate that it could work. If that phase 2 trial is shown to be effective over the coming months, they could go into vaccine production. But what we don't know is how quickly we could get vaccines sufficient to be able to protect essentially the entire population in the world. You could talk about several million doses, which is what they've talked about in Oxford. Of course, there are billions of people in the world. So what about our access to vaccine here in Canada? Unfortunately, vaccine companies over the last decades have consolidated, and that we don't have as many places that can manufacture vaccine anymore around the world as we used to have. I don't know how quickly we'll be able to scale up production of one or more effective vaccines. It is likely that when it rolls out, and whether it will roll out before the end of this calendar year, if it's effective, and that's a big if, I don't know, but it is likely when we do get a vaccine that it's going to be, we certainly won't get enough initially for everybody, so we're likely to have criteria for who would have access to it first. And that will probably be public health criteria based on who's at greatest risk of severe disease. And we know in Canada, that's primarily the residents of long-term care facilities and nursing homes. So those residents, healthcare workers who are in contact with them, older adults would likely be the first to have the vaccine available. But I would not count on a vaccine being broadly available this fall.
Okay. A number of questions are coming in about walking and jogging, and should we be concerned about people walking or jogging and flying by us out in public? You mentioned earlier that the virus doesn't survive very well outdoors. Can you speak, either one of you, to that briefly?
Sure. And whenever I talk about this, some people get angry with me because I think in BC, people have really adopted the idea of social distancing and staying 2 meters apart, which is one of the things we've recommended. It's not the most important thing necessarily to prevent transmission of the virus. More important is staying home if you're sick, making sure you wash your hands frequently, because the virus can be transmitted from contaminated surfaces, and you can stay 2 meters apart from everybody, but if you touch all the door handles and touch your face, you could get infected. But what I have said, and this is true, that the 2 meter recommendation, if someone passes you very briefly within 2 meters, outdoors or even indoors, we don't consider that to be close contact. And there really is no risk of transmission of COVID-19. You really do need that face-to-face contact, because the virus is transmitted by the droplets that are produced when people cough or sneeze, sometimes singing, perhaps talking, but it does need to be that face-to-face contact. So if you're walking by somebody very briefly, we haven't had any transmission with that type of exposure, and we would not even consider that a meaningful contact when we follow up on a positive case. So I think you can be reassured when you're outdoors. I know Eric and I are out walking on the beaches on the weekend. People may briefly pass you less than 2 meters apart, and that poses no risk.
Okay, so just to pick up on that, there was a question about the emergency department and is there a separate entrance? And it sort of dovetails into the response. When you come to the emergency department, we have something called a pivot nurse, a nurse who screens everybody and gives a mask to everybody and sort of separates people into like milk and meat, into COVID risk, not COVID risk. And just, you know, when I first come into the emergency department with my shift, I don't have a mask on for, 10 or 15 or 20 steps. And as Patty says, there's no risk from just the brief passing of someone in a hall or on the street.
I think a lot of us, thank you both. I think a lot of us obviously are thinking about our kids, in all sorts of contexts for this. We've talked about this offline a bit, summer camps and day camps. So I question about that, and I guess related to that, can you talk about the effects of COVID-19 on children a little bit more and the recent developments from Europe, where children have been presented with inflammatory or other types of disease symptoms?
Well, we've had very, very few cases of COVID-19 among young children. In fact, when we look at the people we've tested in BC, we've tested thousands of children between the ages of 0 and 18. Less than 1% of them have tested positive. And the cases among children aged 0 to 9 is a much lower percentage than their portion of the population. Only 0.05% of our cases have been in young children. So young children can be infected, but for whatever reason, and we don't know the answers to this, they don't seem to be as easily infected as older adults. And we also don't see the same risk of transmission. And there's been a lot of review in the world literature at places where they've had much more COVID-19 than here, and they have not even definitively identified any transmission between a young child and an adult. We don't know the reasons for that, but this is one of the reasons why we do believe that daycares and schools are among the early places that we could begin to open up, and I would include day camps in that. Now, we don't have the guidelines for that yet, but I've been talking to daycare operators, and clearly in a daycare setting, you can't maintain 2 meters between children or between the staff and the children. They need to interact with the kids. They need to help them washing their hands and with various other things. And what I've said to those daycare operators is this is a population where there's almost no COVID-19. And there are other things that you can do that can reduce that very low risk even lower. One, children who have symptoms of COVID-19, fever and cough, should not be going to daycare. If they develop those symptoms, they should go for testing, and testing is widely available now, including at BC Children's Hospital. So any child with symptoms can be tested. If they're negative, they could go back into daycare. And the hand washing that I talked about being very important, including among young kids, and the cleaning that daycares do anyway to clean and disinfect surfaces. But the risk is very low because there are so few cases of COVID-19 among kids. Now, I know the one thing we talked about was, can overnight camps come back this summer? And I think one of the things we are concerned about, even though the risk is low, is people who sleep or live in a congregate setting, because we have had transmission occur in some group homes. We're quite concerned about the shelters, for example, in downtown Vancouver. Fortunately, we have not had shelter outbreaks as of yet. We're concerned we have a large group of temporary foreign workers, migrant workers coming to BC who sleep in industrial camps. And we're actually quarantining those workers when they arrive for 14 days before we send them into those congregate settings. So even though the risk is low in kids, I don't think that we'll be moving ahead and advising that it's a good idea to have overnight summer camps where kids would have to sleep together in those congregate settings, because if you did get a case, the risk is greater in that setting. But day camps, I think you will see being allowed during the summer months.
Just to underscore, the Children's Hospital is not seeing, their emergency department is seeing very few cases, and the hospitals around Vancouver that see children are also seeing, unprecedentedly low volumes. Just underscores that children aren't severely affected.
That's wonderful to hear. A lot of questions coming in about the rationale about opening up hair salons. I do my own, and nail salons and those. You do too, Eric. And those kinds of places. Can you talk a little about other than the I guess the vanity need of it all, and what the protocols will be as those open up?
Well, actually, that's the number one question I get from my demographic. When are the hairdressers going to open? They were one of the places closed, those personal service establishments, because by the nature of the work, the worker has to get very close to the person they're serving. Those are still closed under a public health order. So we're talking about opening up, and it's already happening, businesses that were never ordered to close. But those ones that were ordered to close, the bars, the restaurants for in-service dining, and the personal service establishments, that will probably come later. And we are developing guidelines on a sector-by-sector basis for how they might safely open. And we're not the first to do this, because other places have already got guidelines in place for that sector. I noticed in Alberta, in their plan, they intend to open their hair salons in mid-May. They've actually got more COVID-19 than we do, so we can build off those guidelines. But we have a team now, a public health team provincially, that will work with the industry to put in place the appropriate measures that will allow them to safely open. So if you're a restaurant, it could be having tables further apart. I know in looking at one of the US states that had the lowest rate of cases that has reopened, they've got guidelines for bars that people can only be seated at a table. They can't be standing at a bar. For hairdressers, one of the good things about hair salons is it's a one-to-one contact. So the worker is not exposing many people in a congregate setting. It might be measures that reduce the risk. I'm certain that we'll recommend that people who are sick don't go to the hair salon, making sure that the workers stay off if they're sick. And we'll think about other measures. So we're not ready to open those yet, but believe me, I'm feeling the pressure from my my social colleagues to get those open again.
I'm pretty sure this question didn't come from a rabbi, and that makes me even more encouraged. People want to know, when can we gather in synagogue, in our congregations, churches, and other houses of worship, and particularly we're thinking about the High Holy Days, mid-September, October, and what the possibility will be there for large gatherings.
Well, one of the things I didn't mention, but the public health colleagues across Canada, and the areas that they've talked about opening, and I've already mentioned them, outdoor activities, daycare, schools, health services, and others. They also do want to begin to allow small funerals, because we know how challenging it's been for people who have passed away, the fact that people can't come together and acknowledge that. Having said that, there has been transmission in the early days of COVID in some of those social gatherings, weddings, funerals, and other things. So I think it's going to be slow. I think there will be guidelines, but I don't think the 50-person, the other order I didn't mention is an order not allowing gatherings of 50 or more people in the province, one-time gatherings. That may be one of the latest things we lift. And it might be that we start by allowing smaller gatherings and work our way up with some measures in place like social distancing. One of the things I'm concerned about in houses of worship is that we have to protect the people who are older, who may be at greater risk of severe disease. So that, it might be more space between people, hand washing available, and really strongly advising people who are sick not to attend. So those guidelines will be developed, but I can't predict where we'll be in the fall. So we don't yet know what that might look like.
Mm-hmm. Eric, anything to add to any of that?
No, except that if you need, remote tour reading, I can probably come up with.
Thank you. We're getting pretty good at it. So just looking again at our queue of questions here. Eric, here's a question maybe that you can speak to in terms of the ER. How do you deal with social distancing at the ER, and particularly in the waiting rooms?
That's a really good question. So as I mentioned, one of the things we've done is to create these zones, a hot zone for people who are likely to have COVID, a warm zone for people who are suspect, and a cold zone for someone who says, I've just twisted my ankle, right? And so that by separating people, you already reduce a lot of the risk. The other thing we've done is often there are chairs that are side by side in the waiting room, and we've actually used tape to put an X to make it impossible to sit right next to someone. So by leaving one or two seats in between, then you are socially distancing. And the other thing is that currently, and this may change, is that the emergency department is less busy now. So people aren't waiting a long time. Waiting rooms aren't jammed and full. As it turns out that at both Vancouver General and St. Paul's Hospital, mental health spaces have been commandeered. So we actually have a much larger footprint than we traditionally have. If I have my way, we will keep those spaces, and that will create more room and allow people to have not have to sit there cheek to jowl as has happened in the past.
I guess another place that we're often packed in, as you say, cheek to jowl, is public transit. And what are the thoughts about as we open up public transit more, and how we're going to deal with the potentials for transmission and surfaces and cleaning, of our public transit system?
Well, this has been of concern to me because transit is an essential service. One thing we haven't talked about is the measures that we put in place have had negative impacts, and often those negative impacts are among the people at the lower end of the socioeconomic stratum, people who rely on transit to come to work. That includes some of our healthcare workers, like our home support workers and other essential workers. Without transit, they're not going to be able to make a living. They can't provide those essential services. It's been challenging for transit, and I know in Greater Vancouver, because of reduced demand on transit, they've actually cut back services, which paradoxically might mean people are more crowded together. So I think the measures that are in place, which are very similar to what Eric described in the emergency department, the fact that buses only allow rear loading, that's to protect the driver from potential exposures, not opening up all the seats, that's worked well, and enhanced cleaning. And we're not aware of transmission occurring in a transit setting in our region. So those measures have been good. What's more of concern to me is that we don't reduce transit, and they're going to need some infusion from government to be able to continue to operate, as many of our friends and neighbors will need who really suffered economically because of the pandemic. So transit must continue to operate. I think we can provide them guidance on how to operate that reduces the risk of transmission in those settings. And of course, if you use transit, remember the important things. Don't get on if you're sick. If you're going to cough or sneeze, do it into your elbow. I'm not someone who recommends that you wear a mask. If you do, it only protects you from exposing others. It doesn't protect you from being exposed to the virus. But the most important thing is if you use transit, remember to wash your hands. When you get off transit, wherever you're going, when you get home, it's touching those surfaces on transit that could put you at risk.
Yeah, I would just underscore that. And I saw a question about glove use. And you know, you should know in the emergency department, I don't wear gloves to examine patients unless there's a high risk of exchange of fluids. And what I do is I come to work, I sort of grab a computer, and that's my computer. So I clean the keyboard, I clean the microphone that I dictate in, I clean the phone beside it, I clean the surface of the desktop, I clean the mouse, I put away my phone, I wash my hands like obsessively. As soon as I touch what we would call a fomite, that is something where a germ could be attached to, I wash my hands. So you don't really need to wear gloves out when you go about. You just need to remember that if you, let's say, go into the Safeway or the Save-On and you grab a basket, when you're done, wash your, you know, they have the hand sanitizer, wash your hands. When you get home and pack your groceries, wash your hands. Before you eat, wash your hands. And you don't need to wear gloves. You don't need to worry about cleaning gloves. I usually get very angry at my emergency physician colleagues when they wear gloves and they try and wash them. That is considered a poor hand hygiene practice.
Yeah, and just to emphasize that, even in healthcare settings, the wearing of gloves, the concern has been that healthcare workers will use that as a substitute for hand washing or try and wash your gloves. And that could lead to transmission of the virus between patients. The other thing we've seen, even among healthcare workers, is when you're taking off the gloves or taking off the mask, you can inadvertently expose yourself to the virus. And if that occurs among healthcare workers who are trained in use of gloves and masks, members of the public would also have that risk. So if you're out and about, I think it's much safer actually not to wear gloves, but careful washing of your hands and avoid touching your face while you're out. If you put on a mask, if you put on gloves and you take them off at home, you may expose yourself to virus on the gloves or the mask.
Every time you guys talk about this, I want to touch my face.
I know. It's hard not to. We all do it.
Can we talk about testing for a bit? Because there's a lot of questions coming here about testing. Eric, you mentioned a little bit of the numbers of testing. Patty, you did too. We hear a lot about contact tracing. We hear about antibody testing, rapid tests. Can you kind of cover the testing topic of where we are and where we're going to be? I think that's another part of it also.
Sure, I'll start.
Okay.
Do you want to?
Maybe I'll start with the testing part, and then you can talk about the contact tracing.
It's just like home. It's just like home.
Just like at
home. So there are ever-changing but rigorous guidelines around testing, and we're in the phase of the pandemic where the number of cases has decreased significantly, or we haven't ramped up to the point where tracing and is so difficult. So there are guidelines around testing that have been liberalized. So anybody with respiratory symptoms, so the classic fever, cough, or shortness of breath, but also symptoms like loss of sense of smell, which actually is a fairly specific one for COVID, nausea or vomiting, diarrhea, headache, runny nose, stuffy nose, sore throat. Any of those symptoms would probably be a reason to test. We are especially anxious to test people with in certain high risk groups, like certain populations that are being admitted to hospital, long-term care workers and healthcare workers. One of the things that isn't recommended, and I deal with this all the time with my emergency medicine colleagues, is asymptomatic patients. So if you don't have any symptoms, and there's a lot of debate about asymptomatic spread and what that is and how it exists, but for all intents and purposes, the test is not sensitive enough to pick up someone who, in all cases, right? So if you are just at the very, very early beginnings of disease and you have no symptoms, or you have minimal symptoms, the test might not be positive. And so for that reason, you might be falsely reassured, and so we are only testing people with symptoms.
And just to add to that, we are fortunate in BC because we developed our own test here, and we've actually had a widespread access to testing compared, for example, to the United States. So just to give you an example, Canada, and it was a doctor here in the Lower Mainland who diagnosed only the second case that came out of Iran before the World Health Organization even knew they had an outbreak. That was at a time when we were not recommending that travelers coming back from Iran get tested. But because we had widespread access to testing and we told doctors they could test people they were suspicious of, that doctor did that test, and that was a signal to the World Health Organization that there was an outbreak going on in Iran. In terms of current, Erica's exactly right. For a period of time, we were not recommending everyone get tested. We were focusing on only certain populations. Now it's really important, as we talk about lifting some of the public health measures in place, that we're very vigilant about testing anyone we think has COVID-19. Now, there's not many people out there with COVID-19, and the flu's gone away. There's not a lot of people with respiratory illness. Even mild respiratory illness should prompt testing. If you need to know where to get tested, you can call 811 and they'll tell you the testing location closest to you. Many doctors have closed their offices, so they're not doing testing. In our region, the Urgent Primary Care Center on Seymour in downtown Vancouver is open 8 till 10 p.m., 8 a.m. till 10 p.m. Reach Urgent Care Center, which is on Commercial, is also open 8 a.m. to 9 p.m. On the North Shore, we have an Urgent Primary Care Center also available. All of our emergency departments are doing testing, Richmond, some of the smaller sites all around our region. So you can call 811, they can tell you where you can go for testing. The results are usually back relatively quickly because we have labs in a number of our hospitals that are running the test right now. If you test positive, it's my team that does the contact tracing and the follow-up. We follow up every positive test within 24 hours of receiving it. 7 days a week, we have teams here in my office contacting all the new cases. Right now, we're getting very few new cases each day, and most of them are associated with known outbreaks, like the poultry plant outbreak in Vancouver or long-term care outbreaks. There's very little COVID-19 in the community. We follow up those people, and we identify all the people they had close contact with within the period of time that they were considered infectious to others. And we start 2 days before their symptoms start, because there is some evidence of pre-symptomatic spread of COVID-19. I actually believe that people in that pre-symptomatic period, we found that they may have had very mild symptoms like headache or other things. They may not have had the fever and cough, but we go back 48 hours before and we identify everybody they had close contact with in the time they were infectious. We contact those people and we advise them to stay home for 14 days after their exposure, and we call them every single day to check for symptoms. If they get symptoms, then we send them for testing. And we also advise the cases on how they can avoid exposing others in their same household, because most people who get COVID-19 are in their own homes, and we do try and prevent them from spreading it to their household contacts. And so we give good advice to the cases that way. So there's very active follow-up. We've enhanced our public health team to 10 times the number of people we normally have. And we're going to be able to continue, even as we lift measures, to make sure we quickly follow up all cases and identify all contacts.
We have about 10 minutes left. And quickly, what about antibody testing to test if anybody who thought they had it actually had it?
Yes, we are starting to, there are antibody tests, and this looks for people who have been infected. We believe it's an indication that you're likely immune. That still needs to be confirmed. My team is involved in helping validate some of the antibody tests that are rolling out here in Canada. That is just starting this week. I can't predict how we might use that test going forward. For example, some people have suggested, well, if you're going to open things up, It should be preferentially those people who have antibodies. We've had a very low rate of infection in this province, so there are not a lot of people out there who are going to have antibodies. And our modeling about lifting the public health measures does not depend on people having immunity. So we believe we can safely start to lift some of the public health measures, even though we have very low levels of immunity in the population. But I think you will see over the coming months that we will use those antibody tests in other ways, such as trying to determine the true rate of infection by doing a sample of the population or for other research purposes. And so just now starting to validate those tests. They're not yet available in BC.
Okay. We're trying to get a couple of these last questions in before we wrap up. People have asked about university and whether they feel it'll be open for students in September.
Yes. I'm in contact with the Santa Ono at UBC, and the good thing about our universities is they've gone virtual. UBC is not actually closed. There are students still living in residence, and the university is still open. I do think that we were going to be putting protocols in place that will allow universities to open up this fall, but can't confirm that yet because those guidelines are still being developed. So I think it's going to be a combination. I don't think we're going to get away from some virtual learning. Just as many workplaces that have gone virtual, I don't think they will go. We don't want them to go back to everyone going back into the workplace if possible. So it's probably going to be a combination. But I do think by the fall, there will be some opportunity for in-classroom learning in universities.
Do we still need to wash our vegetables and our groceries?
Eric is the one who does the shopping in the house. Eric, do you want to talk about what you do?
Yeah, I don't clean the product that I bring home. I put it away. I wash my hands before and after I deal with it.
But you always wash the vegetables.
I wash the fruit and I wash the vegetables, just like I always did.
But I would say, and we've had this question because, as you may know, we had a poultry processing plant that had a big outbreak here in Vancouver of 42 people. We did not recall the chicken. There's no evidence that food or food packaging has played a role in transmission of the virus. So I know people are taking precautions. What I've advised is, and when you come home from grocery shopping, put away the groceries, wash your hands. But I don't think you need to be washing down everything other than your normal practices of washing your fruits and vegetables.
People want to know, and Eric, I think you addressed this briefly, or maybe it was you, Patty, when medical services are going to go back to something more like normal. There's been some wonderful experiences of some of this, virtual medical visits, telemedical, that kind of stuff. And people have had, varying degrees of success with that. But when will we be able to elective surgeries, see our doctors again, dental, those kinds of things?
I will say that the whole virtual health thing is, that's an innovation that was just burgeoning at the outset of the pandemic. And I actually think it's a huge innovation for healthcare in general, and that will allow people to get in touch with their family physicians much more easily than they used to be able to. It allows, for example, me to provide guidance to physicians in rural places like Bella Bella or Bella Coola, and to provide guidance when they're doing procedures they're not familiar with, or if they're running, if they're looking after critically ill patients. So I actually think that virtual health piece is here to stay. And I think you're going to see this represents a sea change, and that while personal contact with your family doctor is really important, and in the emergency department, of course, this will be something that's a lasting legacy. And I think it's pretty good. Yeah.
I would say also, because I'm planning at the Health Authority, we are planning on how we're going to bring back up things like elective surgery, a number of other health services that we've canceled. Clearly, you can't provide virtual dental care. You need to be going to see your dentist. A lot of this depends on having enough of the personal protective equipment, because those healthcare professionals are going to all have to wear that going forward for the months to come when they provide direct contact with patients, not just the people in the hospitals, but in all the clinics, family physician offices, dental offices. They're all going to have access to that. So that's what we're doing right now. We're getting those plans in place so that we can start to open up again.
Okay. I guess a final question maybe, and that's that in the midst of this, there have been moments of blessing. I know that, as difficult as it is with children and homeschooling and those things, many families appreciate the downshifting that has taken place, the time to be home. The weather has cooperated. Many of us are getting outside more than we were perhaps certainly for our environment. It has experienced a bit of a Shabbos as well, a bit of a rest. Any of these results of positive things you think that are going to continue going forward? What have you seen as sort of some of the silver linings in this that you hope will continue?
Well, one of the things I mentioned to this whole notion of virtual care and the whole Zoom technology that we're using today is tremendous. You know, we have educational seminars and things in medicine, and sometimes it's hard to get 5 or 10 people to come to them, and maybe because people have nothing to do. But you know, the one we had a couple of days ago had close to 100 people, so like 3 or 4 times the normal amount. And I think it's a technology to support medicine and healthcare. It's pretty reasonable. The other things that I think about is, you know, this has been a massive problem to deal with, and I just think about how, you know, people coming together, sorting out a problem, and all the planning and energy and work that have gone into sort of tackling this, which I think gives me great confidence in healthcare. You know, that I think about Canadian healthcare as something that is robust and can work, and we're doing as well or better than almost any other place on the planet. And I think that you know, merits some pause and gives some strength. And I do want to give a shout out to public health and you know, Patty in particular, whose team has worked incredible hours to keep everybody safe. And that's not the question you asked, but that's part of the answer I wanted to give. And lastly, there are some things around infection control practice. I think, you know, hand hygiene has always been something that we strive to do better. And I think because of this, we will consistently do that. I think that's a win. And lastly, there's been a transparency with data that, you know, one of my favorite sites is Worldometer. I don't know if any of you look at that, WORLDOMETER, where in almost real time, you can see what cases are happening around the world. Our own region is publishing data on a regular basis. And there's just a lot more sharing of data and techniques and things that people are doing around the province, around the country, and around the world that I hope will continue.
Patty, before you answer the blessing question, just one piece I did want to ask. We keep hearing about maybe a second wave in the fall. So if you could work that into your answer, that would be terrific.
First of all, we're trying to prevent a second wave. So as we open things up, we're going to be carefully monitoring any rise in cases. And we want to prevent a second wave. We don't want to, and we don't know if this virus will be like influenza, where it might be at lower levels in the summer and recur in the fall. We're assuming it's going to be with us in the summer months too. So let's work together not to have that second wave. In terms of the blessings, this has been challenging for so many of us, but like any war, often there is innovation, and I'm always amazed at how people can come together, and Eric talked about some of the innovation we've seen with technology and other things. So those are some of the legacies, but I don't want to forget the toll that this has taken off of particularly the frail elderly population, those who have family in nursing homes. You can't visit your relatives right now. The people who've lost their jobs, the economic impact. As a public health doctor, I'm concerned about those who are most vulnerable, those living in poverty, and the levels of unemployment and distress we have seen. The demands on the food bank, which has had difficulty continuing to operate because some of their staff don't want to come to work. We need to, as we go through this, continue to support the most vulnerable among us. And one of the things I'm very proud about in Canada is that governments have come together in a nonpartisan way to do the right thing. And we need to continue that. And we need to continue to support people within our communities who are most vulnerable.
I want to thank you both. I want to thank you personally for answering the questions that I've been texting and emailing you, but not just me, to be such an incredible support to the Jewish community, to the broader community. You really are those heroes that we clap and bang pans for, and that we pray for in our synagogues every day. And I know all of the teams that work with you, you know, the doctors, the nurses, the people that are cleaning up the rooms, the social workers, everybody along the line, and of course all of those that are providing the supplies to keep you nourished and to keep you within the PPE and all of those things. I really want to thank you for that, and I want to thank you for taking your time today with us. This has been wonderfully informative, really encouraging, and we hope that we will keep doing, you know, as our doctor orders, so to speak. So thank you very, very much for your time today.
It's our pleasure. And just to say hi to Diane, Eric's mom, and wish we could give you a hug sometime real soon.
That's the perfect way to end a Jewish webinar, with a shout out to your mother-in-law.
I'm going to be in trouble because I didn't say that.
That's right.
You're welcome to turn off your cameras if you want and return to your things. I'm just going to wrap up for those that are watching us. Thank you both very, very much. Again, a thank you to the Jewish Federation as our partner in this. I want to acknowledge that this was made possible by the Caring Community Fund at Temple Sholom, a fund that's been set up to support our congregation and the activities that we're doing and the specific needs of members of our congregation during this crisis. This is one of a 4, maybe 5-part series within our congregation about these types of important topics that we need to talk about as we come through this pandemic. We will be meeting up again on Wednesday at, I think it's also at 1 o'clock for a financial planning webinar. I'm going to bring that up here, right here, I think it is, where we are going to be joined by Gary Zlotnick of ZLC and his partner, John McKinney. They're going to be taking questions about financial planning in the midst of a pandemic. And that'll be followed on May 12th by Dr. Gail Kribble-Zaks, a registered clinical counselor, and Rabbi Brown, who are going to be speaking about the effective parenting that one can do. It's about time during the midst of a pandemic. And then on May 20th, Michael Scott is going to talk about the essentials of estate planning. And we are hoping to get a seminar together, also a webinar together, also with members of the federal government, so we can talk about our government response. We are available for you here at Temple Sholom, templeshalom.ca. Our services are streamed live here on our website at templeshalom.ca/video, on Facebook, on YouTube, and on TELUS channel 8915. Services are tonight at 8:15, tomorrow morning at 10 a.m. Thank you so much for joining us, and Shabbat Shalom.